Welcome, Dr. Karoly.
Thank you. It's been a great pleasure to be a part of helping to plan for the workshop and now to be included in this session. When we designed this session, we sort of viewed it as the residual session to take on some of the issues that weren't covered by the sessions that we had yesterday, which in many respects I think really got at the meat of the issues that we're dealing with. But I just want to step back for a second and just remind ourselves that what we're really talking about, particularly in trying to think about the notion of principles and standards, is that our ultimate goal is to be able to not just look at a given program and make the case that there's a favorable economic return, but to be able to look across programs. And in some cases, that's in the same sector. So if I'm doing work in early childhood, I'm interested in being able to look at the relative costs and benefits of programs within that sector. But in many cases now, policymakers are saying, well, should I be investing in early childhood or should it be school-age programs, or among prevention programs versus remediation? So this ability to be able to look across different policy areas and even within particular policy domains is one of the reasons I think we're talking about having these kinds of standards in place. And ultimately, I think without them, we have this challenge of being able to look at different analyses and not have them be strictly comparable. So this was my laundry list of the various kinds of methods that might differ. Margaret actually put one up that when I quickly looked, I think we have a very similar list in terms of the range of things when you're doing benefit cost analysis. And largely the items on the left side here are ones that we have taken up already, whether we're talking about the cost side of the equation and such details like value in participants' time, and then valuing the outcomes of any intervention or policy with shadow prices, and some of the issues like how we value various intangibles, accounting for deadweight loss, and so on. So that's sort of a set of issues that we took up yesterday. The things on the right-hand side are really issues that we got to some extent, but not in every case, and these sessions today were really meant to help us sort of pick up and make sure we're being inclusive in talking about the set of issues. And this session in particular, we've been focusing on some of these issues at the top of the list on the right-hand side. And I just want to illustrate in the area that I've been working in early childhood programs on some of the implications of some of these choices. So this is just a chart that shows the benefit cost ratios for a series of early childhood programs that have been analyzed either in individual studies or in the case of some of these are coming from the Washington State Institute of Public Policy, their analyses of specific programs. And I probably don't have your latest numbers up here, Steve, so some of these would change if I were using the latest incarnation of the model. And in several cases, we have studies like Perry Preschool here, which have been analyzed starting with data from the age 19 follow-up, and then subsequently with the age 27, and then the age 40. Some of these are results like this is from the Heckman studies looking at age 40 results. This is where there's sensitivity analysis to some methodological choices. The other Perry Preschool, 19, 27, and 40 were all done by the study authors. This is one that we did using data from age 27. Chicago CPC is another one with 2 points in time and the various results. And we talked yesterday, Abecedarian came up. The model that Brooke was talking about, IHDP, is a variant of Abecedarian, and so on. NFP is on this list. So you can see there's quite a range here of results, and even for the same program, even using the same age, like age 40, you see some differences. And one of the basic questions is how much of this is derived by some of these choices that analysts are making. And if we had more comparability, would we be better able to compare the apples to apples? And just to illustrate some of these differences on the set of items that we're considering today across these studies. So this is the list I just had a moment ago. And there are a number of differences. Because of these early childhood interventions, we have a range of ages at which these analyses were based on. So mentioning, peri-preschool goes as late as age 40 with follow-ups. The HIPPY program was one that was based on data as of age 6. IHDP, when that analysis was done, was follow-up only through age 8. And so you could see a range of follow-ups, which means that there's varying levels of information about the extent to which these programs are having longer-term impact. In many cases, there were projections beyond these ages in order to account for possible lifetime effects, but they're starting at different points in doing these projections. Quite a bit of variation in the discount rates being used. So Dick talked about the preferred discount rate. Most of these analyses reported results as sort of their preferred result using 3 or 4%. That seems to be in this area of analysis kind of the convergence or consensus rate. But you can see that most of these studies did do some sensitivity analyses. Not quite the same range that Dick talked about, but as low as 0% and going up as high as 11%. And in some cases, results were reported for the whole continuum and sort of expressing net benefits or benefit cost ratios based on a curve, and others just looking at discrete discount rates. Another difference across these studies is the age at which all benefits and costs are discounted to. And in the early childhood field, because there's different ages at which you can intervene, in most cases these studies said, well, I'm going to discount back to the starting point for this particular intervention. So interventions that start at birth, like NFP, we're discounting back to the birth. Same thing, IHDP, abecedarian. Others interventions that are basically preschool programs starting at age 3, that's the point at which they're discounted. So there's an issue here as to what's the right age to discount to. And when we're looking within a particular domain, like early childhood, perhaps we can agree upon a standard age, because ultimately the decision maker, whether they're looking at early childhood programs or investing later, has to make the decision, do I invest now or do I wait later? Do I invest at age 0? Do I invest at age 3? And if we're looking at benefit cost ratios, this age at which we discount to won't matter. But estimates in levels of benefits, net benefits, and so on, it will matter which age we discount to. And so there's a question for comparability, should we be picking some standardized age at which we discount, either within a particular policy domain, like prevention programs in early childhood, or if we're interested in being able to look more broadly across policy domains, should we be trying to standardize on that issue? Another thing that I've argued is that we care a lot about the different stakeholders that when we're looking at these analyses. So, for example, when Steve presented the results from WISIP yesterday, they're presenting results for what does this analysis of costs and benefits look like from the perspective of the participant in the intervention, what does it look like to the government sector or taxpayers, what does it look like to the rest of society, and then you have society as a whole. And for the most part, these studies were doing that kind of disaggregation into these different stakeholders, although there are some differences in the way the disaggregation is done so that it's not always strictly comparable. Another issue we've been talking about is uncertainty. So I have a column here indicating whether standard errors were reported. And in the cases where I have the yes with a star, those are basically results coming out of the WISIP model, which rather than standard errors is reporting this percentage of the time that you would see positive net benefits. In other cases, you can see that results were done reporting specific standard errors. That's tended to be the case with more recent analyses, and expectation that standard errors would be reported either for measures of benefits, costs, net benefits, or for benefit cost ratios. And then the sensitivity analyses, all of these studies have done what I would call some kind of sensitivity analysis. And I included in this, for example, whether you disaggregated your estimates of benefits to show the different sources of benefits, which I think of as one type of sensitivity analysis, because we want to know how much is being contributed to our estimates of net benefits from a particular type of impact or outcome. And a great example of that is we know that some results are particularly sensitive to our estimates of the crime impact. And so it's helpful to see a line item that says this is the contribution to net benefits from reductions in crime. Because if I as a decision maker have less confidence in that particular element or outcome, then I can make the adjustments in terms of what that might do to estimates of net benefits or benefit cost ratios if that element were eliminated. So some of these are just doing that simple kind of sensitivity analyses. Others are doing analyses where they're looking at sensitivity to basic assumptions in the model. For example, in the Heckman work, the assumption about the size of the dead weight loss from taxation. And so that's a case where multiple results are presented using different parameters. So there's quite a range of what those sensitivity analyses are across, but it has been typical that some kinds of sensitivity analyses were done. So I just want to walk through, in particular, these set of issues that are highlighted in red here, with the expectation that we've covered a lot of what's already on the left side, and some of the other issues are ones I think the next session may also take up. So on the discount rate, as you heard Dick say, I mean, you can really find any justification for any discount rate you like. I listed some here that are prominent: CBO using 2%, OMB recommending 7%, and there are justifications for in between. I didn't go quite as high as 30%, but again, there's quite a range here. And I think ultimately, in moving towards a set of standards, one strategy would be to say, let's identify a base case or a standard case for which we would agree upon, whether we use the principles like Dick talked about, that would help identify what that base case could look like, and then even suggesting alternatives that one would report, and then researchers would of course be free to make a case for using some other discount rate. But I think ultimately coming to some kind of agreed upon base rate would be extremely helpful for being able to make comparisons across studies. On the age discounting too, again, as I indicated, our estimates of present value costs, benefits, and net benefits will depend upon this assumption. It's going to matter more the extent to which we're looking at discounting to age 0 versus age 15 or 16. That's going to matter more than possibly the age 0 or age 3. But I think, again, here, if we can think about identifying what the right base case is, then that's something that we could ask in a standard base case estimate to report, and then some sensitivity analysis to alternative ages. And I think particularly in the prevention field, where prevention may start extremely early or it may happen at later ages, this is an important issue to discuss in order for decision makers to be able to look comparably across analyses. Accounting for uncertainty. Here, I think Anirban did a great job of helping us think through the kind of categories of uncertainty. And I think there's one set of uncertainties that we can address through the way that we report Monte Carlo standard errors for our benefit cost analysis summary measures, like estimates of net benefits or benefit cost ratios. And I think increasingly the kind of figure that Steve's reporting, the percentage of simulations with positive net benefits, is an extremely useful way for decision makers. And these could well, again, be sort of base case expectations that researchers would be expected to report. Beyond that, we know that some other kinds of areas of uncertainty perhaps are going to be better addressed with sensitivity analyses. And so to the extent that we can't put either we've got stochastic or probabilistic uncertainty around certain parameters, then here's where sensitivity analyses could be brought in. And I think I've already mentioned certain kinds of sensitivity analyses, whether they're to discount rate or the age that you discount, but it could be around the shadow prices that are used, various strategies for projecting future benefits. We haven't talked so much about scale up, but that's another parameter, assumptions about whether or not effects would be attenuated or maybe even magnified with scale up. And then distributional weights would be another factor that one could think about, looking at alternative assumptions there and reporting what those results would be. And then lastly, I think we should give some attention to what are the proper outcomes or summary measures from benefit cost studies, because some cases, people only report a ratio, and so it's problematic to be able to recover what the numerators and denominators are. So I think, in general, some expectations around those summary measures. And then I think we also need to account for some of the work that's been done by Dick and others, pointing out that when we look at different projects, measures like the internal rate of return, the way it's traditionally calculated, and benefit cost ratios won't always rank order projects in the same way as you would get if you were looking at net benefits. We've got issues about the scale of projects that can matter in looking at some of these summary measures than others. And there are some strategies for trying to make more reliable or robust estimates that are going to give you consistent ratings, and whether or not that's something that a panel would recommend, I think should be on the table as well, so that we build in some consistency there and ability to address some of the problems with standard reporting mechanisms. So ultimately, I think looking ahead to the possible job of a consensus panel, I think in my mind, some of these issues about how to standardize are going to be easier to address. I've got to put them here. And some of the issues that we're talking about in this session, while they may seem complicated, are probably some of the easier ones that we can kind of knock off. What's going to be more challenging are some of the issues that I think we picked up on yesterday. Everything from thinking about what's the right baseline when we're looking at analyses of interventions or programs relative to a status quo. What is the status quo, and can we standardize on what that status quo is? This came up a little bit in discussions yesterday about early childhood interventions. The status quo when preschool was done was very different from the status quo when you're looking at the Head Start randomized controlled national evaluation at present. So those are issues. Other things that came up yesterday, what outcomes we're measuring, how we value those outcomes, and so on. So I think that's the more challenging set of issues where it may be harder to come up with the kinds of standards. But again, some of the strategies that I've talked about here in terms of setting base case assumptions and then allowing for sensitivity analyses or researcher-defined alternatives can be a way to go. So thank you, and look forward to the discussion that follows.